I think as investors start to figure out the future here for markets, the number one concern is what is happening on the vaccine front, also happening with COVID cases. For the latest on all of that, we're joined now by Yahoo Finance's Anjalee Khemlani. Anjalee.
Thanks, Miles. So, of course, the big news of the day is that Pfizer and its partner Biontech have filed for an emergency use authorization for its vaccine. Of course, the good news being that within weeks, we will know whether or not the FDA is likely to authorize and then distribute this vaccine, making it the first out the door. And it's a big news on a number of fronts. Number one, the fact that it is an mRNA platform, which has never been on the market before, but also the fact that we are getting this vaccine by the end of the year. More than likely, states are already expecting some sort of shipment before the end of the year. So fingers crossed and hoping that it all works out. Meanwhile, in the treatment space, we've got some news as well. First of all, last night, the World Health Organization, a number of doctors in an article in the British Medical Journal did say that they do not recommend remdesivir, and that is Gilead Sciences treatment that we know has been used in hospitals, despite the fact that many health officials, including Dr. Anthony Fauci, have said that the results have been sort of mediocre in terms of actual impact to the patients. And so that's very interesting. Gilead, of course, saying that with the U.S. approval of its drug, it clearly indicates that based on those robust trials, that there is some sort of improvement, and especially at a time where we don't necessarily have very many, some critics saying that generics that are less expensive than the $3,000 price tag that Gilead has are such as dexamethasone are more impactful for severe cases, and so should be used more broadly. But also the FDA did approve a combination of Eli Lilly's arthritis drug with remdesivir yesterday. So, of course, coming back full circle to the U.S. is fully behind this and pushing it forward as well. And so that adds another treatment option for patients with COVID right now. Miles?
And certainly positive to hear those treatment options increasing with hospitalizations right now sitting at a record high. Anjalee, quickly want to ask about some of the rollbacks we've seen in a number of states. California, I think the most notable among them. A majority of their counties, covering I think 94% of the state's population, now have, I guess we could call it a soft curfew in place from 10 p.m. to 5 a.m. And, just kind of thinking about how people who aren't in the news like us see this. On the Today Show today, they were bringing up the CDC's announcement yesterday about recommending folks don't travel for Thanksgiving. I think we perhaps have lost a little bit of the plot on how much it matters for the CDC to come out and say something like that, and certainly signals that we're in a new phase as it relates to the quote unquote reopening that was underway here in the summer and the fall.
That's absolutely correct, Miles. We were looking at the CDC giving us this broad sort of blanket statement, which is hasn't been done before. There have been guidances, but there hasn't been the do not travel, if you will, that was given for Thanksgiving. Of course, hoping to stem the curve of what is likely to be another surge post Thanksgiving, if in fact people do not follow that recommendation. Meanwhile, similarly across the country, you're seeing a patchwork of strategies that have been unfolded, and that is similar to what we saw earlier this year, but of course with much more on the line right now, as we know that a majority of the country continues to be heavily impacted, and we're setting record numbers, whether it is a metric of positivity rates or daily cases or hospitalizations, and increasing deaths, unfortunately, is what we are seeing as well across the country. So all of this put together, of course, to say that while there is not yet a national strategy, we are at least seeing, like in California, the curfew, as well as some stricter restrictions either at the state or local level happening across the country, and hoping that it will all come together to curb the transmission.